Hi everyone, my name is Celestine. I'm a third year medical student at the Icahn School of Medicine at Mount Sinai. I'm really happy to be here to present this topic to you all. It's entitled Motivation of Diverse Patient Participation in HIV Research, a Qualitative Study. And so this study was done in conjunction with the neurology department at Mount Sinai. Before we begin, I just wanted to say that there are no relationships to disclose. And so the background for this study, understanding why individuals participate in clinical research has become a very important topic over the last couple of years. It's really needed to ensure accurate representation and inclusion of diverse and underrepresented identities. In the past, science has not historically included some of these underrepresented identities, including the elderly, people of color, women, for example. And so much of this previous research has focused on oncology studies. It has limited generalizability to other diseases. A few studies have focused on patients with chronic medical conditions, for example, where the benefit to research participation is less clear. And so the focus of our study was to identify factors that motivate diverse patients with chronic medical conditions to enroll in phase 2 clinical research studies. And so these patients or participants were recruited from a phase 2 study investigating vagal dysfunction, gastrointestinal, and immune function in patients living with HIV. And so study participants successfully completed a battery of tests that assessed autonomic dysfunction, gut motility, blood, stool, etc. And so these participants who were enrolled in this phase 2 clinical study already consented to a semi-structured recorded interview and answered a demographic questionnaire. And so the interview transcripts were analyzed for primary themes using the grounded theory methodology. And so for our results, we had 7 subjects that were interviewed, 2 identified as African American, 2 as Hispanic/Latino, and 3 as Caucasian, 4 subjects identified as male, 2 as female, and 1 as non-binary. 5 had a chronic GI disorder, and 4 were HIV positive. And so after we were analyzing the transcripts, we found 3 primary themes. And so theme 1 was all about personal health connections. So 6 of the participants expressed learning more about their chronic medical condition, whether it be the pathogenesis, the cause, or simply just more. This was their motivation for participation in the study. And so we have some quotes here from the transcripts. The first one says, "I really want to do anything I can to understand it being IBS, and have it be better for me." The second quote says, "I had a really horrible experience with diarrhea. That's why I jumped at it, just because it was such a traumatic thing for me." And so theme 2 is all about the health community connection. And so 4 of the 7 participants reported a desire to help their health community, such as their HIV health community. And so the first quote says, "But as an HIV positive man with a history of IBS, if this information helps another soul, even a hair." And the second quote says, "If it weren't for research, I would probably be dead of AIDS. And that's a fact. I wouldn't be here. That's a fact." And our third and final theme is about study team interactions. And so positive and empathic interactions with the study team eased any discomfort of the testing procedures and influenced participant retention. And so our last quote here says, "It was just comfortable. It was just like a girl's day at the doctor or something." So these were our 3 primary themes that we had. And so in conclusion, the study revealed 3 key themes that influence participation and retention and can inform future phase 2 study recruitment: personal health connections, health community connections, and study team interactions. And so future planned studies will examine generalizability of these themes to other laboratories and patient populations. Thank you.